don't be haunted by missed revenue. So you can see, a day before Halloween, we wanted to have a little bit of a Halloween theme. Although just a little trying to be funny there, missing revenue is not something that we want to be haunted by. So we're going to talk to you about that today and how to optimize your processes. So we're glad you joined. We appreciate your attendance. And, whenever MD Audit does these webinars, we want to make sure we send you home with some nuggets of information that'll help your lives get easier and recognize healthier bottom lines. So stay tuned. Kind of quickly, today's presenters. My name is Dana Finnegan. I'm the Director of Market Strategy at MD Audit, and I'm joined by my colleague, Charlie Thompson, who's a National Sales Manager as well as a Sales Engineer. We are, again, happy you're here today. A couple of housekeeping items is everybody will receive a recording of today's session. Everybody will also receive the deck that we're presenting. And at the end, you will be prompted to take a survey. So if you'd like to take that survey, that would be great. It's really to just get your feedback and hear about other topics you may want to hear about or have us present on as we do monthly webinars. So let's kind of get into it. We want to talk about who we are. So I've seen a lot of the logos and the names out there today. I see a ton of current MD Audit customers. So we're really excited to see you. We have some non-MD Audit customers out there as well. So welcome. We're very excited to see you as well. Just as a quick FYI, something we're really excited about is MD Audit acquired Streamline Health in August this year. And really together, what we feel we do, and we're very confident we can do for you is offer you revenue integrity assurance. Now, there's a lot of detail underneath that, but at the end of the day, what that means is we have solutions that can help you in the front, middle, and back of your revenue cycle continuum, help you optimize all of those different parts of the revenue cycle. Again, front, middle, and back. So you're really recognizing healthier bottom lines in a very tough environment with additional payer scrutiny and in reimbursement challenges. So that's something that we are confident we can help you with. And we're going to talk about how we can do that in a moment. But together, we're serving over 200 customers with a nationwide footprint. So just huge community. We have well over 30 years of industry experience in billing compliance, revenue cycle, revenue integrity, coding, and HIM. So, subject matter expertise in all of those areas. And you can just see some of the statistics. We're used by over 140,000 coders nationwide and just a multitude of compliance and revenue cycle, revenue integrity professionals. And you can see here just lots of awards, high trust certified, really a best-in-class platform. But at the end of the day, giving you that assurance that your revenue integrity and that continuum is healthy. I want to kind of leave this up for a minute, just so you can take a look. What we feel as a platform is it should cover you from front, middle, and back. And what we offer here is a set of integrated solutions, really under one roof, that are all working together, serving all of those different constituencies I just mentioned. We have billing and coding compliance modules on the left. Many of you are familiar with some of those. But on the right, we also have revenue cycle solutions. And what's been added to the MD Audit suite of solutions is what is kind of circled in red there. Two products and solutions from Streamline, now under the MD Audit roof, called eValuator and RevID. RevID is a powerful pre-bill charge capture optimization solution, helps you find those missing charges for healthy billing and reconciliation. And an eValuator, which we're going to concentrate on today, is also a pre-bill solution, but that ensures coding accuracy, integrity, highest levels of specificity, and all of that is going to equate to net revenue generation. So both of those products, eValuator and RevID, are huge net revenue generators for our revenue cycle constituency. And today we're going to dive deeper into eValuator. We'll certainly come back and talk about RevID for those folks struggling with charge capture optimization, but we'll do that in a future webinar. But together, integrated under a single roof, we've got you covered front, middle, and back. So to stick with the Halloween theme, what's the poison? What's the problem statement, rather? So we're going to talk about mid-revenue cycle, although we cover, again, front, middle, and back. But you guys get this. Every single day, your healthcare organizations, even if it's a small drip, is missing charges. There's coding errors, all resulting in denied claims. And it may seem, oh, it's a little 1%, 2% here, but what happens over time is that can equate to a ton of lost revenue. And then on top of the lost revenue, huge increases in cost to collect. Days in AR being inflated and reduced cash flows. And unfortunately, that does impact the quality of care that can be provided to patients. So again, we want to help you optimize front, middle, and back. So the mission at the end of the day is so those patients have a good experience at your organization. Little bit more other factors, and these are really things that we've unearthed by dealing with our MD audit community, is what else is going on. And there's, at this time, we're in this really unique period where both humans are coding, but also those autonomous coding engines. Now, we're all really excited about autonomous coding. We think it's really cool at MDaudit, really excited about it. But however, if there isn't QA in effect, in governance, some of those mistakes can be amplified. Some of that stuff that's kind of being spit out of your autonomous coding engines, mistakes can still be made. And if they're not caught in a timely manner, that can be, amplified and really result in some pain. On top of that, humans in autonomous coding happening at the same time, there's unprecedented payer scrutiny. We all know they're doubling down on denials. To mention the MDaudit benchmarking report, we produce one every year. The next one's coming out in just a few weeks, and we'll have a webinar on that as well. We're going to present to you folks a lot of data that we have from within our community on denials, on auditing, on charge capture, all of those things that are important to you. But really where we wanted to kind of focus was from 2023 to 2024, there was a 125% increase in coding specific denials across all care settings, inpatient, outpatient, and pro-fee. And already in 2025, year to date, that has spiked another 25% over last year, most prevalent on the outpatient side. So again, human coders, tough job doing the best they can, and the autonomous coding still resulting in a ton of denials. So we need to have governance and QA looking at that coding quality, integrity, and accuracy on a pre-bill basis to ensure that we are getting paid on the first pass and maximizing revenue. So what's the cure? So we're here to talk about eValuator, and Charlie is going to jump in 1 minute and give a really nice demonstration of that. But I'm going to go through this really quick. What is the big deal about eValuator? Well, I want to first start off by saying it's AI powered. It looks at 100% of your pre-bill claims before they go out the door. It is on the inpatient side, the outpatient side, and the pro-fee side. It's an incredibly robust rules engine with coding resources by AMA, CMS, MACs, official coding guidelines, and again, a multitude of years of subject matter experts that have worked in the coding and HIM space and revenue cycle. And now hyper-powered with AI as well and payer policy. I want to be really clear that eValuator is post-coding and post-CDI, still pre-bill, but it will happen after the coding is complete and post any CDI solutions you have. But the nice thing about it is it coexists harmoniously with any CDI solutions you've already purchased. It really acts as that last line of defense before that bill goes out the door. And again, it's ensuring coding accuracy, integrity, and the highest levels of specificity, all resulting in higher net revenue generation and healthier bottom lines. Really quickly, at the point of coding, eValuator, we run those charges through the rules engine I just talked about. If they're approved for billing, then they go to billing. Real simple. But if it meets a threshold for review, meaning that eValuator flags that pre-bill charge to say there's something here you should fix, it will give you the actual advice on how to fix that. And you can see here, Charlie's going to jump into a real example, but this is telling me with very, very high confidence that if you make the change that is listed here, you're going to recoup or gain $13,000 in revenue. And this is just one charge, one claim before it's gone out the door. You extrapolate that out to all of the neurostimulators that may have an issue. You're just reaping tons of revenue. Last thing I would mention really quickly is a case study, because we can show you anything, we can show you this and demo it all day, but are we having positive outcomes? And actually, one thing I forgot to mention back on this page, but I want you to see it, is customers are seeing an ROI with eValuator in 45 to 60 days. Really small amount of time to see that ROI. And it's delivering about a 12x average ROI. So certainly doing its job and covering that cost. One quick case study before we jump in for a demo is this was a large Southwestern-based health system that prior to going on eValuator was only looking at a small sample of inpatient claims. In order to do that and have any visibility, they had constant in-house IT support or had to rely on IT. And in any audits they were doing, both pre and post bill, were really not moving the needle to improve coding and revenue integrity at the end of the day. So when they partnered with eValuator, this 1,400 bed system, 7 facilities with $2.3 billion in net revenue, in a very short period of time went from an 83% coding accuracy rate to 95%. Really huge improvement. And the total financial impact of this was over $3 million for an 8 times ROI. And we have many other studies that we can, provide to you in how this is helping folks generate more revenue and have positive outcomes. So what I want to do right now is I'm going to stop sharing my screen and I'm going to pass it over to Charlie so he can walk you through exactly how this works and actually the user experience you would have using this.
Thank you, Dana. Give me 1 second here. There we go. Now it's allowing me to share my screen. Perfect. All right, so let me minimize this so you all can see this accurately here. And what I'd like to do is kind of walk you through a very high level demonstration of the software. And to give some context here, what Dana was showing you on the workflow side is all the magic happens in the background through the AI-powered rules engine, as Dana mentioned. So eValuator is doing a couple things for you really, really well, which is taking those millions and millions of data points that you have when it comes to your coded claims data. And then it's presenting those to you on a dashboard that you can quickly and easily drive your attention and workflow to. And so it's really a powerful tool that's going to organize that coded claims data so that your auditors or even your coding managers or folks that are doing that review and education can quickly and easily see what cases most need to be worked and have that high level of confidence that they need that second level review because changes are likely to happen, which results in the downstream effects that Dana was talking about with that net revenue retention, net revenue capture, and stopping that leaked revenue from those common challenges and poisons that we all experience in the revenue cycle. So just to briefly describe what you're seeing here, I have a home page that's extremely customizable. And for everyone on this call, I've set it up in a way to show the flexibility that we can manage inpatient, outpatient, and pro fee. So you'll see here I have some of my total charges held on inpatient and outpatient, how many encounters I have held up inpatient, what my charges are for pro fee. And then I have this encounters assigned to me, which I'll come back to for the auditors. And then you'll see what's assigned to me and my rebuttals that I'm working on within my group as I'm managing that. This is all, like I said, extremely customizable. You can slice and dice your data any way you see fit. This replaces, all the DRG targeting or spreadsheets that you may be working off of in present day, or even trying to build other analytics to try to see this data. eValuator is organizing that all for you, and again, extremely customizable. One neat feature I really like, as Dana mentioned, the requires further review flag. This is really a confidence score and is very unique to eValuator that we are able to help drive your workflow by this requires further review confidence score. And as you can see, I'm very easily able to toggle the encounters assigned to me by this requires further review flag. So I can look at my 100% first, down to 90%, 60%, and 50%. And that kind of gives me a direction of which I could work my cases that need to be worked. But I could do that by financial impact. I could do that by total charges. And again, there's lots of information you can add, many bells and whistles we don't have time to go into today, but that gives you that flexibility on being able to work your accounts efficiently, increase productivity, and again, drive the bottom line. Another neat feature that I'll point out for you is you could take all of the guesswork, all of the sorting and filtering out completely for your auditors or those that are doing the second level review. And we have a Start New Audit feature. The Start New Audit button is basically taking those data parameters that you will set based on prioritization, whether that's requires further review, the financial impact, total charges, lots of different data parameters that sit in the background. And you takes all of the guesswork out. You don't have to do anything except come into eValuator, click Start New Audit, and the case that most needs to be audited based on the data parameters you've set will show up for the auditor. And we'll go into a case in just a second to show you what that looks like. So that will present to the auditors. It takes out all the guesswork and really organizes that for you, which is a really neat feature unique to eValuator. So let's walk through a case just to show you what that looks like. I'm going to select a sepsis case that most of you might be familiar with. This is sepsis as a secondary. And what happens is when I select that case, as you notice from the slide deck, we have this eValuator advice that pops up for the user. And it's going to direct that user on where to take action. And this is another feature that is really going to drive that productivity and efficiency. And so this points the auditor in the right direction. It's just letting them know that it's identifying sepsis principal diagnosis without an MCC. And it's letting them know to make sure, review the documentation and ensure that that's coded appropriately. And there's a potential $6,500 financial impact for this particular case here. So I will exit off this window and I'll just show you quickly how this layout looks. At the top here, you have your demographic information, which you could audit, of course, your DRG and discharge disposition here. In the middle, we have the rules that were flagged for this particular case. So you can always come back to them and see them here. And then of course, we have our diagnosis. If there were any charges or clinical indicators, you would see those here. And then we keep track of coder accuracy, not as a punishment measure, but really a guidance for your organization so that we can get to that benchmark of 95% or greater for the accuracy of your coders. And we track provider accuracy as well on the pro fee side. And then, of course, we track the reimbursement variance and your HCC RAF scores. And so this story, as I'm looking at this, I see sepsis is currently primary and I do have an infection as secondary. I'm reviewing the documentation and realize that really the infection is the primary diagnosis, sepsis is secondary. And so I can need to make some changes on this as an auditor. And what happens is the workflow is very seamless between auditor and coder. The auditor can come in and make these changes very quickly. And then when they complete that account, that'll send it to the coder, so the coder can review those changes and either agree or rebut, and that workflow is housed inside of eValuator. So to show you how easy it is to make these changes, I can simply drag and drop once I've made this determination that the infection is primary. Sepsis is really secondary. And you'll see here a couple things automatically happen. First of all, on the sepsis, it adds a status reasoning for the coding there, which is saying resequence code. Now you can click on this status and you can also edit the reasons for this particular change. Of course, resequence is accurate here, but maybe there was also unclear documentation. This is also customizable, so you can add additional ones here. And you'll see here that it'll put multiple statuses on the same line item. On our icons over here, you'll notice that the financial impact lights up, these dollar signs indicating that this does have financial impact. And I can add a comment specifically on this line item for my coder to review, saying this was changed by the auditor, and I can save that. And when I save that, you'll notice on our encounter comments, that will specifically put that comment on the line item that really directs the coder on where the auditor has made changes and comments for those changes. If I needed to query the provider, I could do that as well by simply clicking on here so I can track the queries that are happening. Or if I needed to remove a line or resequence or add a line, I can do that through this empty box here, as well as clicking the X to delete a line on this icon here. Now you'll notice my sepsis as a secondary here is an unspecified organism. If that needed updating as well, I could simply update this code, or we do have an encoder built into eValuator. I can simply click the binoculars there and I can search, I can look at my guidelines, all of the chapters and verse, my handbook, all of that information is built into eValuator, which is a really nice feature so the auditors don't have to leave the system. And I can do a search, or I can select another code, diagnosis code here for something that maybe is more specific. And just to show you what that looks like, let's say we know that this was staph. It was due to Staphylococcus aureus. I can simply select that from the encoder, and it'll automatically update my chart here. And you'll see the previous code has been grayed out, and the new code is over here on the right now. And now this is a specific code where we have the sepsis is due to that susceptible Staphylococcus aureus there. Now, during that tracking, you'll see here we have tracked that variance of about almost $5,000. The coder accuracy is now updated to 83%, and we've tracked the HCC RAF score as well. And you'll see at the top, we've now upgraded that DRG from an 872 to a 698, resulting in that increase in the revenue generated for that particular DRG. Now, once I've completed my review, there's nothing else to audit or change. I will come down here and hit complete. And once I hit complete, eValuator is going to ask me which of these rules were related to the change. Now, we didn't have time to look at the second one for the demo here, so I'll just uncheck that. We focused on this first one in particular. And so I can select that rule related to the change. If I made any other changes, I could add those comments here, and I would click OK. And then that would then go to the coder for review to make those changes, and then send that off to billing in a pre-bill, or make these changes in a pre-bill state. Once those changes are made, send that off to billing so you have an accurate claim going out the door. All right, I think I left about 5 minutes for any potential questions. So I'll pause there and see if anything has come up in the Q&A for Dana and I to help answer for you.
Yeah, there's actually a bunch of questions, Charlie. I think we'll get to one, which I think is probably most important, because we're going to have a lot of folks here that have many different billing systems, EMRs. This is agnostic to all of that, correct? Can you just
Yeah, that's
elaborate if there's
correct.
any elaboration.
Yeah, absolutely. So it's EMR agnostic. We've integrated with all of your major EMRs. I would say the majority of our customers are Epic, but we also have Oracle Cerner and Meditech and others on down the line.
Nice, nice. And this is another question. This all of the pre-billed charges, again, it's inpatient, outpatient, and pro fee rules, correct, Charlie?
That's correct.
All right. And the last one is this, and this is you and I know this, but we want to make sure the through the audience question is this can be aggregated again across facilities and specialties. You could have 30 different facilities and locations. This is going to look at all of those charges. It's not just for specific facilities. It's across the board.
That's right.
All
Yeah,
right.
especially it gives you that centralized location, especially for your larger health systems to have that centralized location for all the data, especially for leadership. And then you can segregate the work. So if you have, inpatient coders and auditors can separate that from outpatient and pro fee, or you can bring them together. We've also had customers that have utilized eValuator to build programs they didn't have previously.
Mm.
So I'll give you a great example. A client out in New Jersey, they had a really good inpatient program. They used eValuator to build and justify adding additional auditors for their outpatient program
Mm.
because of the revenue they were getting on the inpatient side of eValuator. And so they used eValuator to train their outpatient auditors and and they've taken it to the next level. So it's really flexible and also a tool that you can use for the training purpose as well.
Excellent. Thanks so much for the demo, Charlie. That was great. I know, Joy, you're going to launch a survey we want folks to take. But as we're kind of wrapping up here, I just wanted to say thank you again for your attendance. We really appreciate it. We know you're busy. At the end of the day, we wanted you to see that, at your fingertips, we have all of this information to make you more productive, more efficient, make your life a little bit easier. We know you have a tough job when you're looking at these charges, making sure they're going out correctly. So along with that productivity and efficiency, we want to also help you reap those revenues in such a hard time out there in healthcare. Again, as we say, payer scrutiny is through the roof. So please feel free at any time to reach out to us. We're happy to discuss this more with you, do some consulting on how we can help you with your programs. But again, thank you very much for joining.